you tell us what Lawsonia is and the clinical presentations or how the disease occurs, the different forms of the disease in the pig?
I think the basic feature of Lawsonia is that the bacteria requires to be inside the cells of the host, in this case the pig, to produce the disease, right? To causing the clinical outcome and getting the animal sick. And on the scientific terms, we used to say it's obligate intracellular organisms. That's the scientific mode to call the Lawsonia. And the way that we cause the disease, there is basically two clinical forms of the disease. The first one is the hemorrhagic form, the acute form that usually happens in goats. It could happen also in finishing sites. And the second one is probably the most common one, is the chronic form of the disease that happens on the growing, finishing stages of the production. As the name suggests, it's a chronic disease. So you have the animals having chronic or intermittent diarrhea and intermittent shedding of Lawsonia for a long period of time. Another form of the disease is the subclinical case. It's not a clinical form because it's called subclinical, so you have the animals with poor performance, and sometimes, most of the cases, those animals don't develop the clinical diarrhea that we usually see in the clinical cases.
The subclinical form gets talked a lot about, and some people would say, well, if you can measure performance, then it's not subclinical. But just to be clear, subclinical in the Lawsonia definition would be it doesn't have diarrhea, but it would have performance loss. Does it really have performance loss, in your opinion, without overt diarrhea?
Yeah, definitely. When you see cases of Lawsonia, you may have animals with non-diarrhea and with a lot of Lawsonia in the feces. Right. And then those animals, when they reach the marketing age, they will be a lower performance than the comparable pairs on the pen. That's probably the definition of the subclinical diarrhea.
What would be your recommendation, and what other clinical pictures should really people in the field be mindful of when really confirming the diagnosis of ileitis?
One point of clarification that we hear a lot from the field is that, especially on the finishing sites, when they have one or two animals with diarrhea and here and there when they're walking in the barns, diarrhea, it's not normal. Sometimes we hear practitioners say, no, that's normal diarrhea. So we are taking from the consideration that diarrhea is not normal. If the animal has diarrhea, you have to investigate what's going on that barn. So that's the first step of it. So from that clinical picture, you have the PCR, and if you have a clinical outbreak of Lawsonia, let's put it that way, and you have animals with very poor performance from a welfare perspective, we want to euthanize the animals. And if you have that, what happens with hemorrhagic form, you have the tissue sent to the lab. Once you have the tissues in the lab, the confirmatory definitive diagnosis will be immunohistochemistry, when you are able to see the bacteria inside the cells in an intestinal histological session. That would be the definitive diagnosis of a clinical case of ileitis.
Right.
Diarrhea can be caused by Lawsonia, but it can be caused for a variety of other pathogens too. So we definitely include, on those cases, differential diagnosis of other disease, which will be Salmonella will be the first one, Brachyspira PED, those will be the main concern of that. If you are heading towards a hemorrhagic form of the disease and you have animals with the hemorrhagic diarrhea on the finishing side, you want to look at swine dysentery, Salmonella, gastric ulcers. Another one that we have seen sporadic is hemorrhagic boil syndrome. It's called HBS. In that cases, the animals don't usually have diarrhea or hemorrhagic diarrhea. They die before they exhibited that form of the disease. So those are the important of differentials.